symptoms someone who has asthma should be aware of, like if they're having an exacerbation or an asthma attack?
Right. So usually, as I said, the allergic asthma presents with just allergy symptoms. But if the lungs are affected, then you would feel more short of breath. You would feel that whatever you could do yesterday, you're having an asthma attack today. You cannot do it. If you were able to walk a certain distance, you can't. You're wheezing. You're short of breath. You're coughing. Those are the normal things that the people watch out for. So if there's a change in the way you're breathing, in a way that you're able to carry on your daily activities, if your cough has changed in any way, so some of the things that you have to keep in mind, and if that's the case, that you're probably getting into an attack or an exacerbation of asthma.
Episode of Doc Talk Live. Doc Talk Live is a health show dedicated to educating its listeners about a different health topic each week. We do so by bringing on medical experts to our show. Be sure to send in your questions through Facebook Live on Wednesdays at 5 p.m. You can find more information about our show on Facebook, Instagram, Twitter, YouTube, and our website, doctalklive.com. You can watch all of our episodes on Spotify, iTunes, and iHeartRadio. My name is Dr. Huda Arif, and I'm today's host. And joining us will be Dr. Humayu Anjem, and to educate us and discuss the topic of asthma and allergies. Thank you, Dr. Anjem, for joining the show and taking your precious time out. Welcome, and tell us a little bit about yourself.
Thank you, Huda, and thank you, Doc Talk Live, for having me and giving me this opportunity to talk about this important topic. I am a pulmonary and critical care physician, and I am primarily practicing at Baylor Grapevine Hospital, where I do ICU medicine as well as pulmonary medicine. And we also have our clinic in Baylor Grapevine Medical Office Building, as well as the South Lake area, where we take care of patients as outpatients as well. I am kind of new to Dallas, so I just recently moved, and previously I was in Corpus Christi, Texas. So we've been here about 2 months with my family, and so far we're really enjoying it.
Well, welcome to Dallas. We're so happy that you decided to move. We need more doctors like you, and such an interesting topic to talk about, something my own family members go through. So let's get into it. Allergies and asthma. What is the common factor?
So I think the the thing that people need to realize is that there's two different types of asthma, and one is our allergic type of asthma, and one is the non-allergic type. We'll just focus on the allergic type of asthma since I think it's more common and more people are concerned about it. So it starts off with allergies. People have symptoms that are triggered by some of the environmental agents. So if you have, for example, we have tree pollen, or you have dust mite, or pet dander, or something of that sort that just triggers that inflammatory response. It leads to histamine release, and that causes inflammation in our body. Antibodies are released, and the whole cascade of events that happens after that causes us to have those symptoms such as nasal congestion, stuffy nose, clogged up sinuses, and some of these inflammatory mediators, as we call them, can travel to the lungs as well and cause this inflammation in the lung, which can cause asthma. And it's a very common problem. About 25 million people have asthma in the US,
Wow.
and that's a huge number.
And is it something you would then obviously mostly experience during, seasonal allergies, or the pollen season, or the spring is when you really, experience symptoms, and otherwise? So
Right.
how would you differentiate allergic asthma from a non-allergic asthma?
So mostly people who have allergies, commonly they have a family history of allergies. So either your mother or one of the parent has some allergies, and that translates into the kids having some allergies. A lot of times these symptoms sort of manifest just how allergies would, and then eventually, if, as I mentioned, some of these things travel to the lung, they can cause wheezing, they can cause shortness of breath, and that's how usually you would notice most of the time that you're experiencing asthma symptoms, which are probably related to allergies. Now, having said that, I think one of the common things that people think about is like if it's not wheezing, it cannot be asthma. It's definitely possible that you can have asthma, and there's different presentations of asthma. So I think it becomes a little more challenging to diagnose asthma if you're not having the classic allergy symptoms, and then you have to look for other indications. But with allergic asthma, you would expect some of the same symptoms that people have with allergies, and then you would also have some pulmonary or lung symptoms, as we call it. So that's what we usually look for.
Gotcha. So, who's more prone to develop your allergic asthma?
Um, the same thing that we were talking about, I think the people who have a strong family history of allergies,
Mm-hmm.
they are the ones that who would usually develop this type of asthma, and even as young kids, I think you can notice, especially during the, as you were mentioning, the the seasonal times, where there is a huge load of pollen. So especially days which are more sunny, windy, we expect a lot of pollen outside, and those are the days where the symptoms would become a little more, sort of prominent in that sense. So you would, I think I tell people that they are the best judge of their own health. So you would notice that whenever you're exposed to a certain trigger or agent, you would experience those symptoms. But a strong family history is very suggestive that you are probably going to be developing allergic asthma if you're already predisposed to having allergies.
Got it. So, what are those triggers? You're saying there could be some allergens
Sure.
triggers. Can we talk about that?
Sure, yeah, there's a vast majority, I think, of triggers that we usually see. Pollen, which is kind of different from one place to another.
Mm-hmm.
I think there's a lot of geographical variation. So
Mm-hmm.
when I lived in South Texas, especially in San Antonio and Austin area, there's a lot of cedar. So
Mm-hmm.
some people are allergic to cedar, but pollen, dust mites, pet hair or dander, as we call it,
Mm-hmm.
those are most of the common ones that we see. And then pollen can be in different forms. It could be, different trees that can generate that pollen. Um, and usually those are the ones that we most commonly see. Of course, I mean, cockroaches is another one. So there's tests that we can determine, and we can use those tests to figure out what you're actually allergic to, and then sort of desensitize, eh, you know, for that particular agent. But those are the most common ones that we see. Some people have asthma already, and that's exacerbated by some of the other symptoms like cold or weather changes and things like that.
Right. Yeah. I mean, it's interesting you mentioned about cockroach because I actually had a patient like that at some point, and
Right.
I was surprised, and I was like, I've already only read it, I've never seen it, but I see one now, so that's actually
Yeah.
true. So, interesting. So, how do you control allergies and asthma?
And that's, I think, where, that's $1 million question. That's where I
That's where
feel
the
like
pulmonologist
that's where the
comes in, right?
pulmonologist comes
That's
in.
where we call you and
Um,
see you.
exactly. But I think that's a challenge, especially I feel like if it's just more allergies, I feel that's a big challenge, just because I feel like you're constantly exposed to the environment. So if
Right.
you're allergic to like five, six different things, it's just so hard because you can't eliminate that out of your environment completely. So it is not easy to control those symptoms. You just have to be a little more cautious and sort of cognizant of the fact that these are my, sort of triggers. And it takes a while to understand those things, but people start to realize over a period of time that these are the things I should avoid. So I think that helps when you're talking to the patients. They kind of know that these are the things that predispose my allergies or my symptoms. And then, as I mentioned, there are some allergy testing that you can test for the most common triggers and then find out what they're allergic to. And then, in that way, you sort of develop a strategy to see how you can control those symptoms and minimize the exposure to those allergens.
Gotcha, gotcha. So, how do you, when someone comes to you in office to, with asthma, how do you diagnose it for them?
Um, so first of all, I think people need to realize that when they have these symptoms, they need to seek medical attention. Because a lot of times I feel like we just blame them on allergies, but once they start bothering you too much, I think it's beneficial to seek medical help. Usually, with asthma, we have what we call as pulmonary function tests, And then we have some other tests that we can use to diagnose other types of asthma. A lot of times, people have a history of asthma, especially if you're dealing with people who have asthma that they've developed early on in their life. And that the history is very suggestive a lot of times of asthma by itself. But we have various breathing tests that we use to diagnose asthma also.
And then, what is the treatment like once someone's diagnosed? What kind of treatment do you guys offer?
Sure. So it just depends how bad your asthma symptoms are. People, I think one of the things that people think about is like some of the diseases are curable. I do feel like nothing is really curable in that sense. We control a lot of things, whether that's diabetes or high blood pressure. It's controllable, but we can't eliminate them. So there's always a chance that you can always, sort of outgrow it and then develop your asthma again based on the exposure to triggers and all those things. But the treatment generally involves what your symptoms are. So we have, talk to the patients, figure out how their life is, how bad their symptoms are, and based on that, we develop a strategy whether you need to do some medications as needed or you need to be on some medications that you can use every day, which is most of the time that's what we do to keep you on maintenance inhalers, as we call it, to keep them under control.
Now, you almost said that, but I was going to ask you, do you outgrow asthma, like especially when you see them in younger kids?
Sure.
Do you see that pattern or?
Absolutely, I think that's very common. I have seen a lot of people where they develop either as young children or adolescents. They develop asthma, and then by adult age they've outgrown it. But I've always noticed that still, if predominantly if it's like allergic type of asthma, I've always noticed that they rebound a lot of times, especially with our environment changing these days. There's just a lot of triggers out there, so I do feel that they need to be, sort of cautious in terms of taking care of themselves and realizing that if the, symptoms come back, then they should seek medical help. And in those cases, it's sort of symptom dependent whether you want to keep them on the medications for a brief period of time, and then you reassess them and see how they're doing. And again, if their allergies and triggers are more seasonal, then you just preemptively put them on those medications. So that way, I usually tell them that I know if your triggers are going to happen in the next 6 weeks, if you're allergic to these things, and we know the season is coming, 6 weeks preemptively I put them on controller medications, which means maintenance medications. So I put them on it, they take it every day, they continue it through the allergy season. Till the allergy season is over, I know that these were their triggers, and then I slowly take them off those medications. So they don't necessarily have to be on the medications all the time, but that just depends on how your presentation is.
Yeah, variable patient to patient and
Absolutely.
how they respond
How
to
they
different
respond to
treatments
different
and all that
treatments.
stuff.
Absolutely.
Great, great. So, we were just talking about before the show started, we were talking about COVID
Right.
and 19, COVID-19. So, what does your history of asthma put you at risk of if, God forbid, you get COVID?
Sure. I mean, I think that's very interesting. I was particularly very interested because, you see patients in the clinic all the time, and everybody's question was, especially during that pandemic time when we were not really seeing patients in the office, but even when you talk to them over social media, they were like, doc, I should be the one getting the COVID vaccine because I have asthma. Right? Everybody's concern was they have some sort of lung disease. But there's been quite a number of studies. They've looked at a lot of patients, and what they found out was, interestingly, that asthma does not put you at an increased risk
Wow,
to
interesting.
to die from COVID. So the
What?
death rate or the mortality rate, as we
Mortality.
call it, was the same for patients with asthma having COVID or patients without asthma having COVID. And
What about the
that
morbidity?
again, there was no big difference
Wow,
in the
interesting.
risk of like hospitalization. Actually, they noticed that people who had asthma were less likely to be hospitalized. And again, the reason was not clear. I could not.
Inhaling steroids, was
I
that
think
part
so.
of the
Yes, you're
treatment? Because
absolutely right. Yes,
they're
that's.
actually, I was reading up somewhere, they're actually in India and all these other countries, they're actually giving inhaled steroids now as a
Yes,
part of treatment. So
exactly.
maybe
So
that's
I think
what.
that was it, or somehow they've, somebody has looked into these receptors in the lungs,
Mm-hmm.
and somehow in these asthmatics, the receptors are not as sticky, so the virus doesn't bind to them as
Oh
much.
wow,
And then
interesting.
secondly, I think very good point that you brought up. I think that's the most likely scientific
If there's
explanation.
someone who are on like
Or on
scheduled,
inhaled steroids, I
yeah,
think that was a protective factor too. So it
protective
was
factor.
interestingly, it was actually that you have asthma and you were less likely to be hospitalized. So,
Right, maybe that was probably why you're.
but again, this is based on some of the studies we have. These are not like
Oh yeah.
studies, and I always tell people, no matter what happens, take your precautions.
Get vaccinated.
Get vaccinated.
Uh-huh.
Sanitize, wear your mask, do all the things that you were doing generally to avoid yourself from getting sick.
And so, on the same lines, so asthma particularly would not increase your risk of having any poor outcomes from COVID-19, right?
Right.
Perfect.
Right.
Perfect.
Yeah.
Perfect.
I mean, obviously, we know that asthma is a bad thing. We see so many people die from asthma, and part of it, I think, is the lack of education and just the lack of understanding of the disease, knowing that how to control the disease, and I think that's the major contributor towards bad outcomes or bad things that happen in people with asthma.
So, what are do you hear like some common myths about asthma?
Oh yeah, there's people come up with a lot of things. I've had people ask me if this is just like this is just in the head. Do I just like really believe that this is a disease? I mean, I wheeze, but my uncle told me that asthma is not a real disease. So I think that's one of the myths that I come across. It is a real disease, of course, because a lot of times I think people felt like they had asthma, they had some sort of stressful event, and then they got short of breath, so everybody was like, oh, this is just a panic attack, you're just panicking. So so we know that asthma can be triggered by these kind of events, whether that's an environmental event such as cold weather, whether that's a stressful event or situation in your life. It can bring asthma symptoms, so it's not all in the head, it's actually a real disease, and it needs to be treated. Couple of interesting other things I think I've come across is like, um, they're like, my kid has asthma, my kid cannot go and play or not do this because he's got asthma. So now I'm
Oh
like,
yeah.
this is not a disease that should prevent you from being on the sidelines. You can go and carry on with your life. You just have to be on the right medications, the right treatment, and seek help, from a medical professional whenever you need it. And they can help your kid, or even as adults, whatever you're involved with. Of course, with certain limitations, depending on how your disease is, but you can have a normal life. So those are the two, I think, common things that people ask me. And then, yeah, and then one of the other thing that you had mentioned before, I think, like, doc, I outgrew my asthma. Now I can never have asthma again. And
Yeah.
that's the same thing that I think we had talked about before, that it's always possible to get those symptoms back, but we can definitely help you control it.
Right, yeah. So you mentioned about not being treated and complications of asthma. Let's talk a little bit about that. Like if you leave your asthma untreated, what happens next?
Right. Um, I think the major problem is obviously that every day becomes very difficult for you. I think it's hard for us sometimes to imagine, because we just take so many things for granted, and especially after this pandemic, we take like a lot of our breathing issues for granted. We're like, oh, I'm breathing normally. We don't have to make a conscious effort to breathe, or do anything. We just breathe normally. And a lot of people who have these lung diseases, I feel like they're so conscious about breathing, because they have to make that effort, they have to use their respiratory muscles to breathe.
Right,
And
right.
for us it's just like normal living.
Yeah,
So I think we
passive,
just
yeah.
don't pay attention to it. And people who have lung disease, I think for them every day, like I've had people who've got bad lung disease, whether that's because of bad asthma which is uncontrolled or some other lung disease, and you cannot even like carry on with your life. You can't even dress yourself, you feel short of breath. So I think just having to live that life every day is
Or
is
you're
is such a
dependent on
such a
oxygen, or
right.
dependent on your active effort to breathe.
And you're just like asking people for help, so I think that's one of the, the morbidity, I think, in that sense, that you're not able to just live a normal life,
Mm-hmm.
which I think we should be able to help you do that with so many medications. And things in medicine have changed so much. We have so many different options that definitely, we can try and control the symptoms. So I think that's one of it. And then obviously uncontrolled asthma, we've seen like nightmares happen, we've seen people die. I think close to about 10 or 13 people die in the entire country every day from asthma, which is a big number, I mean, in that sense. And that number is much higher in, developing countries where they don't even have the resources. We're lucky that we have a lot of resources, and we should make use of it.
All right. So we mentioned about obviously these complications. So what are the symptoms someone who has asthma should be aware of? Like if they're having an exacerbation or an asthma attack.
Right. So usually, as I said, the allergic asthma presents with just allergy symptoms. But if the lungs are affected, then you would feel more short of breath. You would feel that whatever you could do yesterday, you're having an asthma attack today. You cannot do it. If you were able to walk a certain distance, you can't. You're wheezing. You're short of breath. You're coughing. Those are the normal things that the people watch out for. So if there's a change in the way you're breathing, in a way that you're able to carry on your daily activities, if your cough has changed in any way, so some of the things that you have to keep in mind. And if that's the case, that you're probably getting into an attack or an exacerbation of asthma.
So is there something you could do immediately to prevent that as an attack or allergic asthma reaction you're having?
Yes, I usually tell people that they should have a good supply of their rescue inhalers at home. I usually, what I call as an action plan. So I discuss it with my patients, and I tell them that I will have them keep some inhalers at home, rescue inhalers, as well as some steroids, which are very, very, very helpful in an asthma attack. So I usually call in some extra medications for them so they have it at home. If I know that they frequently get their asthma attacks, then I have some breathing treatments, or we call the nebulizer treatments at that. So that way, at least it prevents them from ending up in the emergency room. And we've seen that even if they end up in the hospital with their symptoms getting worse, at least they're not that sick that they end up in the intensive care unit, or end up on
Requiring
life
more intense
support or
care,
something of
yeah.
that sort. So at least that initial kick from the steroids and the rescue inhalers and nebulizers, I think, helps them kind of control the disease at that moment, even if they end up in the hospital. And most of the time, they don't even end up in the hospital. They call and said, you know what, doc, I just took these medications for 3 5 days, whatever, and I feel better now. It was just an attack and it resolved.
Great. So, and when while talking about this, like anything you want to add about allergy shots, how important they are?
Sure. Those are also, I think, a good consideration if you're just thinking that you're allergic to certain triggers. So even after doing the allergy testing, you figure out that these are your triggers. The allergy shots, the purpose is, what they do is they give those shots, it's called immunotherapy, in other words, where you develop an immune response. So they slowly, over a period of time, give you these shots to develop an immune reaction to those certain triggers that your body finds harmful. And over a period of time, the idea is that you become desensitized to those triggers, and finally those symptoms don't happen. So yes, people do benefit from it, depending if you have a limited number of triggers where we can tackle them.
Is that something you do in your office as well, or
We don't.
you refer them to the
Right. We
allergist
usually, have an allergy specialist do those things.
to take care of
To
that?
take
Well,
care
that
of
was a
the.
great conversation, Dr. Anjum. Any last minute thoughts?
No, I think the season is coming. It's getting hot. It's getting windy.
Really, yeah.
The allergy season is going to be there. I just tell people, just be cautious. Keep a sort of a watch for your symptoms, and if anything changes, let your doctors know and seek help.
Great. Thank you for educating all of our listeners.
Thank
It
you.
was very informative. We found that very helpful.
Appreciate
If they
it.
need to get in touch with you, how can they find you?
So I'm in practice, and our office is in Grapevine and South Lake, and I can later on maybe share some other information
No,
if
you can
needed.
share it now.
Okay.
so they can listen. Yeah.
So our office is in the Baylor Medical Office Building, right next to the Baylor Grapevine Hospital, and it's called the O2 Pulmonary and Sleep Group. And if
Your
you
phone
know they need
number
to,
you wanna tell?
sure, yeah, I can absolutely. I don't remember at the top of my head sometimes,
Oh, gotcha.
but
Okay, well, we
I
can.
can definitely share that. And our number for the office is 469 306 1112. And if any help is needed, please free to call us.
Great. So that was it, you guys. 469
675 306
30
1112.
1112. Perfect. So thank you, Dr. Anjum, for coming on
Thank you
the
so
show. This
much.
is Dr. Arif signing off. See you guys next week.